Glaucoma Awareness Month, the leading cause of blindness that affects millions of Americans.
We've talked about it before with Dr. Bearie from the Grand Rapids Eye Institute, but today we're going to find out a little bit more about the specifics of glaucoma.
Thanks for being with us here, Dr. Bearie. What exactly is, we talk about glaucoma, what exactly is it?
Glaucoma is pressure in the eye, so to speak. It's not related to blood pressure. There's actually a clear fluid inside of the eye that bathes the eye. If it were red like blood, we couldn't see anything other than red. So it's this clear fluid that circulates. There's a pressure gradient that circulates in the eye, and it brings the nutrients to the inside of the eye. So it doesn't communicate with the outside of the eye, so it's not affected with tears, and it doesn't affect the blood pressure. So it's unique to the eye. And what glaucoma is a problem with the pressure. The pressure gradient, whether it's produced too fast or drained off too slow, the pressure goes up and it starts to damage the weakest part of the eye, which happens to be the optic nerve in the very back of the eye.
So treatment is actually geared toward a pressure target?
There's a pressure target, and it's misleading because many people say, well, that's all we're looking for, is what's the best pressure to have. And it's very individual. Once we make the diagnosis of glaucoma at an eye exam, and patients will not know that they have it. It's very silent. Once we make the diagnosis of glaucoma, we see how severe the glaucoma is, then we have a pressure, a target pressure. And that target pressure is different for everyone. Now, if you don't have glaucoma, the normal patient, the pressure is anywhere from 10 to 20. But once you have glaucoma, it's very individual.
Okay, and the test, is that where they put the puff of air?
Yes, that's one of the tests is to the puff of air. The other one, we have like a little blue light that comes real close to the eye. We have an ultrasound that can measure the pressure. So a lot of different ways to measure the pressure.
It's real sophisticated.
It is, but that's just one piece of the puzzle. Once we measure the pressure, we have to look inside of your eye. We look at the optic nerve. We grade the optic nerve. We have other sophisticated tests that check your side vision, and we can actually now take a picture of the back of the eye, and we can measure how much tissue loss you're having.
Wow.
So really, what does treatment consist of? And how does that affect the pressure?
So the treatment is consisting of preventing you from progressing to vision loss. So we have to do very sophisticated tests on an annual basis, and then throughout the year we check the pressure. And treatment consists of several eye drops, and eye drops vary from once a day to twice a day. Sometimes one drop will work, sometimes several drops will have to take effect. Other times, if it starts to progress, we have to go to laser treatment and even surgery.
But there are no signs of the earliest stages of the development of this?
No, there are none. You know, if patients come in and say, you know, I think I'm losing part of my vision, it's very end stage.
Really?
So they really don't know they have it. Even when we're putting them on drops, they'll say, gosh, I don't feel like I have glaucoma. I don't see any different, but that they have it. So they really don't know.
Well, you're saying that it's really different for a lot of individuals. There are different types of glaucoma.
There's a lot of different types of glaucoma. Glaucoma is a general type of eye disease, but it really depends on why they have the glaucoma, and that's how we base its name. So whether they have pigmentary dispersion syndrome, pseudoexfoliation, narrow-angle glaucoma, open-angle glaucoma, there are different types, but for patients, it's individual again.
And the most important part of that is getting detection early.
Detection early is by far key.
Okay, so where can people find you and get in touch with your office?
We're right on the corner of Burton and East Paris, and they find us on the web at GrandRapidsEyeInstitute.com, and we're on Facebook as well.
And I know that you update your page a lot too, so it's a great way to get in touch with you and to call, because I know that you have a great staff there.
Oh, we've got a wonderful staff. Thank you.
It is really fantastic. Well, we trust you with our eyes. I know you did my LASIK surgery several years ago, and I just want to say thank you so much. And as we continue to educate our viewers about these really important health issues, we thank you for being part of it.
Well, thank you for having me.
Yeah, stay with us. We'll be right back.